Ensure privacy and perform hand hygiene. Then introduce yourself to the patient and identify the patient using 2 identifiers.
My name is Becky, and I'm the nurse here to administer your eye drops.
Okay.
Can I go ahead and verify your name and date of birth?
Sure.
What is your name?
It's Lon Tucker.
And your date of birth?
Ask if he has any allergies.
Thank you. Can I ask, do you have any allergies?
No.
Okay, very good.
Eye medications can be formulated as ointments or drops, such as over-the-counter products like artificial tears. Eye medications also include prescription agents, like those used to treat infections and glaucoma. Before applying any eye medication, check the patient's medication administration record, or MAR, against the provider's orders.
I'm going to go ahead and raise up the bed just a little bit.
Follow the 6 rites of medication administration and do the 3rd check of the medication at the bedside. Remember to check the expiration date of the medication. If drainage or crusts appear on the inner canthus of the eye or on the margins of the eyelid, gently wash from the inner to the outer canthus. If necessary, gently loosen crusts by soaking them for a few minutes with a warm washcloth or cotton ball. Do not scrub the eyelid.
I have a second washcloth. I'm just going to dry your eyes.
Okay.
Is that okay?
It's good.
Okay. I'm going to administer your eye drops.
To instill eye drops, perform hand hygiene. Apply clean gloves.
I'll go ahead.
Ask the patient to look up.
If you would just look up.
Using your non-dominant hand, hold a clean tissue on the patient's cheekbone, just below the lower eyelid. Gently press down with your thumb or forefinger against the bony orbit to expose the conjunctival sac. Never apply pressure directly against the patient's eyeball. Rest your dominant hand gently on his forehead. Holding the tip of the container 1 to 2 centimeters, or about 1/2 to 3/4 of an inch above the conjunctival sac, instill the prescribed number of eye drops. If the patient blinks or closes his eye and the eye drops land on the outer margin of the eyelid, repeat the installation. When you're using eye drops that may have systemic effects, use a tissue to apply gentle pressure to the nasolacrimal duct for 30 to 60 seconds per eye. Again, avoid putting pressure on the eyeball. Ask the patient to close his eyes gently and briefly.
I'm going to go ahead and administer your eye ointment. I'm going to go ahead and put on some gloves.
To instill an eye ointment, perform hand hygiene and apply clean gloves. Help the patient into a comfortable position, such as the supine or Fowler's, or sitting upright in a chair with his neck slightly hyperextended. Ask him to look up.
I'm going to have you look up.
Hold the applicator above the margin of the lower lid. Then apply a thin ribbon of ointment evenly along the conjunctiva of the lower lid, moving from the inner to the outer canthus.
If you could close your eye.
Ask the patient to close his eye and rub it lightly in circles with a cotton ball, unless doing so is contraindicated. For any type of eye medication, remove the excess from the eyelid, if needed, by gently wiping from the inner to the outer canthus. Dispose of your gloves and tissue or cotton ball and perform hand hygiene. Document administration of medication in the MAR. Note patient response and report any adverse effects to the healthcare provider.
I'm now going to place your eye patch on.
If an eye patch is needed, place a clean one over the patient's affected eye, covering it completely. The patch must be taped securely, but it shouldn't press on the eye.
I'm going to secure it with 2 pieces of tape. One more piece. Does that feel comfortable?
That's fine.
As part of your follow-up care, encourage the patient to demonstrate self-administration of his eye medication. Reinforce your teaching as
And
needed.
here's a Kleenex.
All right.
Don't forget to look up while you're placing the drop in. Very good. In the middle of the lower lid. And then apply gentle pressure.
How's that?
Very good.